The reopening of Connecticut after the coronavirus shutdown. On May 20th, we'll learn when things will start to return to normal. But what will normal look like? Jeff Flaks, CEO of Hartford HealthCare, is with us. Also, one of the state's most powerful Republicans is stepping down. We'll ask Themis Claridis what her next move might be. Plus, demonstrations demanding the state reopen early. Who are these protesters? We'll talk with the organizers. It's all straight ahead this last Sunday of the month, April 26th, 2020.
From Eyewitness News, Connecticut's most watched local political program, this is Face the State.
Good morning, everyone, and thanks for joining us. I'm Dennis House. You just saw the newest Connecticut COVID-19 numbers. Hospitals are under tremendous pressure these days in treating the sick. First off this Sunday, the president and CEO of Hartford HealthCare, Jeffrey Flaks. And Jeff, thank you once again for joining us this Sunday morning. It's becoming a bit of a tradition.
Good morning, Dennis.
I want to ask you, first of all, because we heard this week that the naval ship, the USS Comfort, was being moved out of New York because of a lack of demand, and some of the field hospitals there aren't being used as well. Should we read these signs as good signs that perhaps that the virus is lessening in its severity?
These are terrifically important signs. We're seeing in New York that they're seeing successive days where they have less hospitalizations. They have parts of New York that are starting to return to bring other essential health care services up. So it's very encouraging. And we're seeing even here in Connecticut now, not a trend as long as we're seeing in New York, but we are seeing an early trend where it's starting to moderate in terms of our hospital level activity.
In terms of the field hospitals we set up here in Connecticut, are they being used at this point, or is the demand not just there?
Yeah, they haven't been activated, but Dennis, I will applaud the state. I think it's essential that we set them up. I'm very pleased they're still there because they're an important relief valve to us. So we hope to never use them, but we need them until we're at the point in time we have full confidence that we won't have that level of demand.
What are we talking about in terms of flattening this curve? Where do we stand right now?
So our projections, and I think, Dennis, we've talked about in the past that we partnered with MIT and the dean of the analytics program at MIT, Demetrius Bertsimas, and he ran projections for us going back almost 8 weeks ago. And it really called for the height of our curve to be around May 1st. And today now our projection is around April 27th. So we are seeing, and we've had our own experience at Hartford HealthCare, we've now over the last 3 days seen about a 5% decline. So I think we're tracking fairly close to our modeling, and we're thrilled to see that.
Kevin Rennie has a column in the Hartford Current this weekend suggesting that perhaps the Yukon Health Center should be used as a COVID-only hospital so that the other hospitals like Hartford Hospital could be freed up to just take care of regular patients and regular medical needs. What do you think about that idea?
You know, it's interesting. There's a lot of thinking going around. There's lots of different considerations. I think the practical issues are going to be such that there will be COVID-19 in our community. And all hospitals in Connecticut are going to have to be capable of segmenting the COVID-19 patients and at the same time providing the vast majority of services that we normally would provide under traditional circumstances. So I think it's probably most likely, or I think entirely, we could expect that all of our institutions will be caring for people with COVID-19 and at the same time safely and in a very protected environment caring for all other people in the community.
I want to talk about your staffers who really are healthcare heroes these days. They're working long hours and going into really dangerous situations, dealing with COVID-19 patients. Are they starting to get a little bit of a break now that things seem to be slowing down a little bit?
Well, their resilience is extraordinary. It's inspirational. And people working on the front lines, they're absolute heroes. I'm amazed and in awe of the commitment, their expertise, their empathy. So I tell you, I wouldn't say they're getting relief today. They're standing ready. They're still caring for a very significant number of people who are infected with COVID-19, and they are still at this point on high alert as we still work through this. So I think we need to maintain that level of focus and that attentiveness to the circumstances until we get farther along and we get a little bit more comfortable with the trend line.
We heard of someone this week who died in another part of the state. They'd gone to a different hospital. They were having some heart issues, but they were told that this was elective surgery. It could be put off. That person ended up dying. And I know a lot of people are concerned that perhaps they're not getting their cancer checkups and their mammograms and their regular checkups because they're afraid to go to medical professionals and hospitals because of COVID-19. What do you say to them today?
Well, it's a really important issue. And for emergent care, for trauma care, for cancer care, for stroke care, heart and vascular related care, none of our institutions have ever shut down. They're fully open, they're fully staffed and prepared to take care of people under all circumstances. But there is a natural trepidation that we do hear about in the community for people having a reluctance to come to the hospitals. And I want to assure you, we've put every precaution in place within all of our facilities that we can safely take care of people who need health care. The second issue, though, you were raising, Dennis, is the need for all of our hospitals to stand back up and move to what are characterized as elective surgeries. But truthfully, all healthcare is essential. And I do think on the horizon, we're working hard that all of our hospitals can comfortably stand back up as we manage the trend lines that are in front of us.
I remember when Karen and I had our children, it was a great event. We had lots of relatives come to the hospital to see the newborn babies and so forth, but that's not allowed right now. What is the particular procedures that are in effect right now? Let's say a woman goes in to have a baby. What does the husband do, and are other family members allowed to visit?
Yeah, so the partners can be with the people, a partner can be with the people who are delivering babies, thankfully. But we do have visitor restrictions in place across all of our institutions. It's to protect our patients, it's to protect our staff during this process, and it's proven to be very effective. When we look in our organization alone, less than 1% of our staff, 0.8 in fact, of our staff have actually tested positive for COVID-19. So the measures we've put in place around personal protective equipment, visitor restrictions, the temperature controls we've put in place for people entering our facilities, it's working.
This past week, many health care professionals were shocked by what President Trump had to say about perhaps using disinfectants in a person's body to help fight COVID-19. When you heard him say that, what did you think?
I didn't hear him say it personally, but I think what we need to do in all circumstances is listen to the expertise, the medical leadership. We have incredibly talented and gifted people in infectious diseases who have extraordinary experience. There's wonderful research, there's wonderful innovation. And I think it's critical we defer to them. And I think in our state, with the governor's leadership, with our organization, and with other health systems, we've really charged these leaders to work together collaboratively, and they're helping us in our state immensely.
Jeff Flaks, the president and CEO of Hartford HealthCare, and please, on behalf of all of us here at Channel 3, please thank all of your colleagues there, the doctors, nurses, medical professionals doing a great job during this crisis. Thanks, Jeff.
Oh, I will, Dennis. We cannot thank them enough. Thank you.
Thank you. When we come back, a big announcement by one of the most powerful Republicans in Connecticut. And we welcome you to watch past editions of Face the State right now on our YouTube channel, including my interview with Governor Lamont is on there as well. It's on YouTube and the WFSB app.